Let's give a big round of applause for Michelle Azarin and the admissions team, without whom none of you be here today. And where's our Dean of Students? Quinn, can I ask our Dean of Students, Quinn Hussey, to please stand? I just can't, stay standing. I just can't pass up this opportunity to publicly embarrass Quinn. Quinn, what did you win over the weekend? I'll say it. So Quinn just came back from DC after winning the award for the best dean of students for all the schools and programs in the country or in the world. So if you come to UC Berkeley, that's what you're gonna get. Well, good morning, everyone. Welcome to Spring Visit Day, and welcome to UC Berkeley. So first of all, let me just take a moment to say congratulations on being accepted to Berkeley Public Health. I hope you take a lot of pride in this accomplishment, especially knowing just how competitive our applicant pool was this year. Your acceptance means not only that you're truly one of the best and the brightest, but that we believe in your promise to change the world, to make the world a better place. Now you got a big decision ahead of you. You have to decide where to go. And our job today is to help you get to know us better so that you can make an informed and perhaps life-changing decision. Now, as the dean, there are two questions that I get asked most often during Spring Visit Day. The first is why Berkeley Public Health? As I said in the video that was sent with your acceptance offer, that you should come here not only for our spectacular weather and campus, or the rich diversity of our people, cultures, and food, or our geography of genius, not only across the Berkeley campus, but really across the entire Bay Area, the Silicon Valley. But most importantly, you should come here for the people, for the community. We are a community of innovators, change makers, and arc benders, 400 faculty and staff, 1,300 students, and 18,000 alum strong, all working together to help bend the arc of the moral universe toward health equity, toward social justice. And whether that's fighting for healthcare for all, or fighting to protect reproductive rights, stop gun violence, slow climate change, save the environment, dismantling institutionalized racism, fighting for health equity and social justice, that's what we do. That's who we are. That's what our community is all about. Now, the other question I get asked a lot is, what's your vision for the school? So I want to take just a few minutes to talk about the vision. And let me just say that it's really not just my vision. It's our collective vision, our collective aspiration as a school of where we want to go in the next 5 years. It really comes from a collective sense of urgency. Our world is in trouble. Our house is on fire. And yet most universities are still sitting on the sideline watching the house get burned down. So that's why a few years ago, we all decided that as one of the best schools of public health in the world, we're not gonna sit on the sideline anymore. That in the coming decade, that we're gonna roll up our sleeves, we're gonna go all in to try to solve some of the most pressing public health challenges of our time. But what can a university do, really? I would argue that there's a lot that we can and must do. In fact, I believe universities are one of the few places left that could still change the world. And we change the world through the research we do, the student we educate, and the social change we help bring about. So in research, in the next 5 years, I want us to become the innovation hub of the world in public health, innovating solutions to public health's biggest problems. Now, when you think of some of the biggest problems facing the world today, when you think of some of the greatest existential threats to humanity in 21st century, from climate change to pandemic outbreaks, from chronic diseases to social inequality. These are all problems that require public health to be front and center in driving solutions. And we want to be leading the way in finding solutions. And we're going to do this by bringing together the best and brightest faculty and students. And in the last 3 years alone, I've recruited 18 of the best and brightest in the world to join our faculty. And we're going to do this by promoting transdisciplinary collaboration, recognizing that we're never going to solve these big global public health problems by staying in our own little silos. But instead, by harvesting this amazing brain power around us, not only across the Berkeley campus with some of the most brilliant minds in biology and chemistry, in data science and engineering, in social sciences and public policy, but also across this Silicon Valley at the cutting edge of medtech and biotech revolutions, and across the state of California, which has always been on the forefront of healthcare and public health transformations, accelerating health innovations for the public good, translating research to world-changing impact. In education, in the next 5 years, we want to become the best school in the world for public health change makers. Now, the reason for that is that most of you come to Berkeley, and most of you come into public health because you want to help change the world, right? You want to help make the world a better place, which will require a world-class education, not only in the core public health sciences, but in change-making tools and skills like leadership and management, collaboration and communication, strategic thinking and community organizing, policy and advocacy. Now, the problem is that most schools of public health actually don't teach change-making very well. And that's why when I became dean here 3.5 years ago, one of my top priorities is to make sure that by the time that every student graduates from Berkeley Public Health, that you are equipped with the knowledge, the tools, and skills to go out and help change the world. And whether that's kind of bringing about organizational change, system change, community, societal, or global change. Now, speaking of changing the world, historically, universities have a twin mission of research and education. But increasingly, educators are talking about a third mission of the university, which is all around social impact. That universities exist not only for the generation of knowledge or the education of students, but really for the betterment of our community, of our society, and for the world. Now, in the coming decade, we aspire to become the School of Public Health best known for our social impact in the world. And we'll do so by continuing to fight racism and all forms of social injustices as a root cause of much of the health inequities that we see in this country and around the world. And we'll do so by strengthening our community engagement, recognizing that we're not going to change the world by staying in our own little ivory tower. That Berkeley has always been and is the birthplace of community-based participatory research, the powerful idea that when we do work in the community, we do it with the community and not on the community. And one of the most important lessons that we learned in the last 50 years in global health is that simply parachuting into a community with our answers and our solutions, our vaccines and our foreign aid won't create sustainable change. That if we want to change the world, we're going to have to partner with our communities in building capacity, building systems, and co-creating solutions to decolonize global health. So let me just close with a personal note about what Berkeley Public Health has meant to me. Because I'm not just a dean, I'm also an alum. And like for so many other alums, Berkeley Public Health changed my life. See, I was the son of 2 immigrant parents who never went to college. In fact, my mom, she never went to high school or even junior high. See, my mom was only 11 when her father died. So as the oldest girl in the family, she had to drop out of 5th grade to go work in the factory. When I was born, my family was still pretty poor. The first home I was born into was this tiny little apartment on the other side of the tracks in Taipei where a family of 6 was crammed into. No flush toilet, no running water. Health insurance, we didn't have health insurance because there weren't such things as health insurance back then. So whenever you get sick, and unfortunately I was sick a lot as a child, you never knew how much the doctor or the medicine was going to cost. And from time to time, my parents had to make that difficult choice between paying for food or paying for medicine. And at one point, my mom sold her wedding ring to pay for my medicine. So now, fast forward 45 years, I'm sitting in the West Wing of the White House, waiting for a meeting to get started. Now, I was the head of maternal and child health for the Obama administration, and the Obama administration cared a lot about children's health. So I was actually at the White House quite often, but most of the time I was over at the Eisenhower building, at the office building. But this time the invitation was for the West Wing. So I was pretty excited. I show up early just to check things out, sitting in the waiting room, the Oval Office came right in front of me. The president wasn't there that day, but I was just checking things out. And then we got ushered into the Roosevelt room, was right across from the Oval Office. And 5 cabinet secretaries show up. Secretary of Agriculture, Commerce, Labor, Transportation, and Education. Now, this was a meeting to talk about how do we tackle child poverty in rural America. As you know, 1 in 3 children growing up in rural America today is growing up poor. And it takes this kind of transsectoral approach to tackle a problem as big as child poverty. So there were probably about a dozen of us across the table. At one point, we started talking about healthcare. I just remember Secretary Vilsack and all of them just turned to me and said, "Well, doctor, what do you think?" And the first thing that came to my mind was, all right, just don't say anything stupid, right? But then I was really proud that I was there. That in a way, I was a voice for the voiceless. I was representing the voice of millions of children and families in this country who will never get to sit at that table. So you might be wondering, why, how does a poor, sickly little boy from Taiwan get to become the head of maternal and child health for an entire nation, and now the dean at the best public university in the world? I would say lots of love and lots of luck, but also those 3 foundational years right here at Berkeley Public Health that gave me a world-class education that really changed my worldview about what health and healthcare is, and what my social responsibility as a physician is all about. And the foundational knowledge, tools, and skills I needed to go out and change the world. And the support, the love, the mentoring, the nurturing I got that helped me believe that I too can make a difference in the world. So obviously, I love Berkeley Public Health, and I ask you to join me. If you're looking for a community of innovators, change makers, and art benders, if you're ready to roll up your sleeves, to shake up the status quo, to fight for social change, and in the words of the late Congressman John Lewis, to get into some good trouble for health equity, for social justice, for a better world, then Berkeley Public Health is the right place for you. Fiat Lux and go Bears. Thanks, everyone. And now, it is my greatest pleasure to introduce our Chief of Diversity, Equity, Inclusion, Belonging, and Anti-Racism, Ms. Ché Abrams.
Hi, everyone. Ché Abram, again, Chief of Diversity, Equity, Inclusion, and Belonging. Have any of you watched the video with me and Quinn? No? You should watch it. It is so entertaining. We watched it last week and we were like, oh my gosh. Okay, anyway. So Welcome and congratulations to this moment and this experience and everything you have done to lead up to this moment. I don't have a super prepared speech like Dean Lou because I like to kind of work on the fly, which tells you a lot about kind of who I am and how I operate. And I want to start by telling you why I chose Berkeley Public Health. And so I've been with the school for 2 years. And years ago at my former institution, it was health sciences, and I had the luxury to attend the Othering and Belonging Conference. And that conference was like all kinds of topics and things, but I kept finding myself in these sessions hosted by and like panels of people from the School of Public Health, faculty members, students who had done like powerful research, people from Policy Link who again were alumni from Berkeley Public Health. And I just sat there in my moment and I was like, these are the people I want to work with. These are the folks who are doing the research about the communities we care about, with and alongside the communities, to answer their questions, to provide proof to their stories they have been telling, so that the rest of us in the world can take that research, can take that practice that you all have been doing and live it and make it breathe, right? And so when I had the opportunity and I saw this position, and I even said it in my interview, people were like, why us? And I was like, because you're amazing and I have to be here. That time years ago, I said, if any position opened up in Berkeley Public Health, I didn't care if it was administrative, if it was events or whatever it was, I was applying for the job so I could be a part of this environment. And so I was given that gift 2 years ago to be here. And so I just want to let you all know I have experienced that every step of the way. And when you go to your faculty panels, your alumni panels, you meet with the team. I saw Quinn and Dean Lou walking around, chit-chatting with all of you. That is what you will get every single day when you are with us and in our environment. My vision as a chief of diversity, I am more of your warm and cozy side of things. While there's real serious stuff that I do and take initiative around, I just want to highlight and let you guys know that I am all about building what I consider my vision for a healing-centered environment. Do any of you know about Dr. Nadine Burke-Harris's work around adverse childhood experiences? So I actually went ahead, even though I have degrees in business and even though I'm in diversity, and got the training and the certificate around the ACEs certification. So I did that work because I'm that passionate about making sure and addressing like our trauma and our experiences and trying to create these more healing environments so that we can better work out the issues happening in the world. And so my vision of that in our school is that I want each of you to walk away once you graduate from Berkeley Public Health to be able to mitigate those harms, either as an individual or collectively as a body. I want to see compassion alerts when you are doing presentations. I want to see us maintain psychological safety. I want to see wellness built into your schedules. Take a time and start with mindfulness. I want to see you take a walk in the middle of, not really in the middle of class, but take care of yourselves. I want to see you practice somatic things that make your body feel better and readjust, right? Because those are things you're going to be able to pass on and model for others as you go. I want us to explore what building trust feels like, define what radical safety is for us. I want us to understand and practice boundaries and like recognize boundary expression in all the ways that can be passive and manipulative and assertive. And I want us to practice collective accountability. That is the biggest one that everyone is always concerned about. And in that conversation around collective accountability, what I learned from one of our public health students who does this work is we have to explore our relationships with punishment. We have to explore our relationships with violence. And what else can we provide in this environment that is accountability, that helps us be different from how we've always known what accountability to look like, right? And not in every case, but in most cases. And so, what does that have to do with anti racism, diversity, equity, inclusion, belonging, and justice? If you can't hold all of those spaces, explore those things as an individual, as a group, if you can't build that into what you're studying and into your environments, then we can't be collective and be in this room together. It's just as simple as that, right? Because at the end of the day, this work isn't about continuing to ostracize or play what people call the oppression Olympics. This space is for us to be together, to build together, and create a new legacy of what things will look like in the future. And students do that through the student organizations that we have. And there's many. We have a wellness committee. We have an Asian women's group. We have our Black advocates group, our Alianza, I want to call them Latine, but our Alianza group. We have lots of groups and organizations you can be a part of wherever your passion lies, either within the school, our Palestinian public health, or outside of the school in some of the cultural centers and things on campus. Students also name things publicly. I have gotten quite a few emails publicly when I make a statement or something is going on in the world and I haven't addressed it. People either email us as a whole leadership team or as an entire school, or they come to me one-on-one and say, I really would like you to do this. And in different ways, I collaborate with students to write those statements to make sure I'm being aware of issues and we're addressing things. You can also partner with faculty to update courses and build curriculum and have guest lectures and things like that. And there is a group of students who have updated the environmental health sciences breath course this year. And naturally, you can do it in your research. Always in your research, always in your practice, always with the communities you bring attention to. One of the beautiful faculty that Dean Liu just mentioned as being a new person coming on, when I sat through their presentation, they talked about making sure that research is accessible in heritage languages. And I just thought that was the most profound thing to do as a person from the United States of America to make sure work is accessible to the people who need to read it. And it spawned an idea in me that, hey, we need to make sure that our work is published in more lesser known journals. Not that you need the top high, most important journals in the world, but you also want to put them in open sources so that your community can actually read them, access them, and utilize them. And you actually want to work with your community so they can publish alongside you and they can get that credibility built up for themselves, right? So those are like some of the many ways that you can live and breathe these things. I want you, as I summarize, because I'm being faster than probably my time, but remember that growth is that your growth in this world and in this space is what moves us towards health equity. Whatever you do, whatever you have contributed, everything you have lived in your life from every single moment, as Dean Liu said, and things you've witnessed, things you've experienced, and whatever you've navigated, wherever your passion was in some of the writing statements and things I read, because I did read some of your applications, all of that has led you to this moment, and all of that will lead you to your future. You do not have to have it all figured out right now. You do not have to have it all figured out tomorrow or 5 years from now. Just go along the journey, embrace what it is, and continue to move us in a direction. And I just want to leave you with the words that I learned from Oprah Winfrey, who I think learned them from Maya Angelou, but your legacy is in the lives you touch. So as you model all of these behaviors, you model this experience, you model this research, as you publish and do your things, thank you very much, you are going to create a legacy that lives in all of us. Thank you.